Yesterday, we talked about what a tummy tuck will achieve and won't achieve. Today, we're going to talk about recovery, specifically the first 24 hours. So, people always ask me, does it hurt? Well, it doesn't feel good, but I can guarantee you that it is manageable and that nobody regrets doing the surgery. So, in those first 24 hours, you are going to go home the same day. You're going to be groggy when you wake up in the surgery center. You're going to become more with it, probably towards the end of your stay there. You may not remember much of that stay or much of the ride home that first time in the car. You'll go home either in a binder or your garment that is placed on you, and you may notice initially that you feel cold and that you're shivering. That's not unusual. It can be from the anesthesia, it can be from the tumescent solution we give to patients when we do the liposuction. So that is something patients commonly note. Because of all the fluid you get, you also might feel like you have to pee very frequently. And in those first couple days, your body is going to start diuresing and peeing off all of that extra fluid you got during the surgery. Your stomach, your abdomen is going to feel tight right away. So you're not going to be able to stand up straight. You're going to be hunched over when you walk. It's also not unusual to be nauseous. I do give you medication for nausea because the anesthesia that they gave you during the surgery can cause nausea, and then the pain medication after the surgery can also cause nausea. You're probably not going to have much of an appetite in those first couple hours. I encourage patients just to drink fluids as much as they can and maybe try some soup and a nibble of crackers so you have something in your stomach when you're taking the pain medication. Now let's talk about the pain. So when you leave the surgery center and when you get home, your abdomen probably is still pretty numb from the tumescent solution that we give you during the liposuction that has lidocaine, numbing medication in it. And I do inject lidocaine and bupivacaine directly into the rectus muscle for some more pain control. So those last several hours. It can start to kind of wear off into the night. Like if you were a first start surgery, maybe 8, 9, 10 p.m., it's starting to wear off. So I always tell patients to not get too behind the pain and not wait till the pain is a 10 out of 10 before you start taking something. Now, part of my pain protocol is I do give you 2 pain medications that you actually start the night before surgery, and those medications are non-narcotics. Now, I always check on everybody in the evening to make sure everybody's settling in okay and that there's no issues, no red flags, nothing that I need to see you for. And everybody is generally doing okay. Nobody's crying in pain. It's all manageable for people, usually between maybe a 4 to a 7 on the pain scale. So that first night is kind of a blur. You're in and out of sleep. Your chaperone is in and out of sleep watching you that first night. So not everybody is getting a great amount of rest that first night, but everybody is making it through without needing additional pain medication. No, I will see you the next day. So you are going to come into the office for me to see you. That ensures that A, you're doing great and that there's nothing of concern. I can check all of your incisions. I can check the garment and make sure it's not too tight. It's not creasing you or creating unequal pressure points. And I also make sure that you're walking because we want to make sure that we are decreasing our DVT risk. So you're likely going to start some injection of a blood thinner that next morning after I see you. And I'm making sure that you're moving and you're walking well so that you're not frozen in bed. So that's the first 24 hours in a nutshell. We'll talk about the next 48 hours to 1 to 2 weeks after surgery next.